name is Dr. Wee Lai Hock. I'm a consultant orthopedic surgeon at Island Orthopaedic Consultants. My subspecialty interest is foot and ankle surgery, and I would like to talk about bunions and Hallux valgus deformities. So what are bunions? Bunions are basically a painful bump on the inner side of the foot which will cause pain when it rubs against the ground or within or inside of a shoe. So what are the causes of bunions? There are many causes and associations. There is a genetic predisposition or cause. Sometimes it runs in families. Another association is when ladies wear shoes in narrow toe boxes, and people who wear shoes with pointed fronts. Then there are also people who have hypomobile joints or flexible joints, which gives rise to flat feet or flat foot. So those are the normal causes or associations for bunions. What are the symptoms? The symptoms are usually pain, which occurs along the inner side of the foot where the bunion is, but sometimes they can also occur along the ball of the foot at the sole part. So people with bunions typically complain of pain around those areas. The pain can occur while the person is walking, or it can also occur at rest, especially so after a long day of walking. The patient will then return home with a lot of pain in those areas, and often the patient complains of a throbbing pain which causes them to either elevate the feet or to ice it. What are the treatment options? The treatment options would be both non-surgical and surgical options. Non-surgical options would be to wear shoes which are broader and comfortable. Some people will use an orthotic insole to help to address the flat foot or flat feet to relieve the pain over the bunion. There are also bunion or Hallux valgus straps that you can use to basically straighten out the toe, and you can also take painkillers or anti-inflammatory medications to relieve the pain. There is also a surgical option if non-surgical treatment does not work. The surgical option would involve realigning the big toe and the foot, and the procedure is called scarf osteotomy of the foot. Basically, in bunions or Hallux valgus deformities, what happens is that the first metatarsal bone starts to drift inwards too much, and the big toe over here will then be turned outwards. So in the scalp osteotomy, what we are doing is making a cut through this bone in the first metatarsal and then shifting it across so as to narrow the foot and allow the big toe to be realigned better on the first metatarsal bone. So this surgical procedure is a very good procedure in realigning the big toe on top of the first metatarsal and correcting the bunion. The recovery for this procedure is progressive. Typically, the patients are able to walk on a pair of special sandals or heel walkers for about a month, and thereafter the patient will then have to undergo a course of physiotherapy, and they will be walking further over the next few weeks, and they will begin to run at about 3 to 4 months after surgery.